Awareness of Cancer Warning Signs by Daniel Prieto, Bertha, Celis, and Lazina Johnson. Introduction. Cancer is a group of diseases characterized by uncontrolled growth and spread abnormal cells. There are over 100 types of cancer, and it can take over any part of the body. Cancer is an extremely serious disease, and about 39.6% of the population will be affected by cancer at some point in their life. The best way to improve chances of surviving cancer is the early detection of cancer. To detect cancer early, it is important to know the 7 warning signs of cancer, which can be remembered with the acronym CAUTION. Caution. C. Change in bowel or bladder habits. A. A sore that does not heal. U. Unusual bleeding or discharge. T. Thickening or lump in breasts or elsewhere. I. Indigestion or difficulty in swallowing. O. Obvious change in a wart or a mole. N. Nagging cough. Stomach cancer risk factors. Family history of stomach cancer. Poor eating habits such as not getting all of the nutrients. Smoking. Long-term inflammation in the stomach. Stomach polyps. Pernicious anemia. Eating contaminated foods with aflatoxin fungus. Stomach cancers continued. There is some evidence that eating a significant amount of salty food and food preserved by salt increases the risk of stomach cancer. Salt can damage the lining of the stomach and causes inflammation or may cause the lining to be more sensitive to carcinogens such as nitrates. Salt can interact with a bug called Helicobacter pylori that can cause stomach ulcers and stomach cancer. Risk factors can include smoking, excessive alcohol consumption, smoked foods, consumption of large quantities, and, as mentioned, diet. Early signs may not appear, but as it progresses, one may feel discomfort with gas pain or a vague feeling of being full. Other signs may include nausea, vomiting, weight loss, excessive burping, and weakness. Warning signs of stomach cancer. One of the major warning signs of stomach cancer would be change in bowel movements. This can be a clear indication that there is something wrong with the stomach. Changes in the bowel can also be caused by the risk factor of diet high in fatty foods and low in vegetable and fruits. Another major warning sign of stomach cancer is indigestion or trouble swallowing. This can be a major problem with people who suffer from acid reflux. This is an indication that your stomach and other connecting parts to your stomach are not working how they are supposed to. Effects of stomach cancer. Personally, stomach cancer will affect a person personally because they will not be able to do the things that they used to do. They will struggle to do what they are accustomed to, which leads me into my next point. Psychologically, stomach cancer will affect someone psychologically because they will get frustrated because they are in constant distress. They will also have a high likelihood of being depressed because they are seriously ill. Someone with stomach cancer has a lot of worries, which can lead them to having a tough time psychologically. Socially, stomach cancer will affect someone socially just based on the fact that they may be so sick that they will not be able to communicate how they did before. They will not be able to go out at all, and they will be more than likely having a lot of physical issues. Prostate cancer risk factors. The biggest risk factor for prostate cancer is age. After the age of 50, the chances to get prostate cancer drastically increase. Also, about 6 out of 10 cases of prostate cancer are in men over 65. Another risk factor is race, because African Americans have a higher chance of prostate cancer than men of other races. Another big risk factor is family history. When there has been multiple people in the family that have developed prostate cancer, then the odds of developing prostate cancer increase. The survival rate of prostate cancer is actually pretty good considering it is still cancer. Almost 100% of people with prostate cancer will survive 5 years after diagnosis. About 95% will survive 15 years after diagnosis. Warning signs of prostate cancer. The biggest and most obvious warning sign of prostate cancer would be a change in bladder habits. This makes sense because it is in the path from the bladder to the penis. Because it is so close to the urethra, if something is wrong with it or it is inflamed, it can cause problems with urination. This will be a noticeable problem because it causes either no urine or having to go urinate too much. With prostate cancer, there also can be some bleeding or discharge, but these are not common warning signs of prostate cancer. All cancers are serious, so it's crucial to know when there is something wrong with the body. Effects of prostate cancer. Personally, prostate cancer can affect someone personally because they have to go through a daily struggle of having urine problems. Many times it can be painful and annoying to either feel like you have to urinate and cannot, or if they are constantly having to urinate. Psychologically, the difficulties with urination can be very frustrating on a person, which may lead them to be angry and on edge. Also, the stresses of having cancer and having to deal with it every day can be challenging to handle mentally, especially if they have children. Socially, frequent urination can affect socially because they will never be fully present when they are with people because they will constantly have to excuse themselves. Also, instead of being present with the people they are with, they will be thinking about where the closest bathroom is. Skin cancer. Skin cancer is related to ultraviolet radiation. The UV light that penetrates the skin is made up of two types of radiation that include UVA, penetrates dermis, and UVB, that penetrates epidermis. Where you live can affect your exposure to UV light due to the altitude, geography, weather conditions, and factors like the season and time of day. Noon is when the sun is at the highest point of the sky, so it's recommended to stay indoors when possible. The three main types of skin cancers. Three main types of skin cancers include basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Basal and squamous cell carcinoma develop from prolonged repeated exposure to the sun. Risks and occupation that put you at risk include construction workers, farmers, people who regularly sunbathe, people who use tanning beds and are outdoors for a significant amount of time are most at risk for skin cancer. Basal cell carcinoma. This appears like a mole or chronic pimple with pearl-like borders and becomes crusty, scaly, and may ulcerate and bleed. Affects people older than 40 years of age. Develops on portions of the skin exposed to sun. Tumor removal includes surgery and chirotherapy. Squamous cell carcinoma. Appears flat, red, scaly, and slightly elevated. Develops in portion of skin exposed to sun like basal cell carcinoma, most commonly in light-skinned people. Dark-skinned people can develop this as well from sunlight exposure. from chemicals and high levels of X-rays and trauma. Tumor removal same as basal cell carcinoma. Malignant melanoma develops on any skin surface, eyes, and mucous membrane. Appears asymmetrical, irregular borders, multiple colored, and a diameter of ½ inch. Mostly a disease of whites. High risk include living close to the equator, features like light hair, blue eyes, freckles rather than tans, and exposure to sun for short, intense periods of time. Men and women 65 years of age, melanoma may appear red, raised with regular borders, and may itch and bleed. Also, at a considerable higher risk are people who first-degree relatives have had melanoma or more than 2 relatives with history of melanoma. Reducing your risk. Sunscreen usage, SPF greater than 15 on skin, wearing wide-brimmed hats, wearing sunglasses that are larger and block 99% of UVA and UVB radiation, clothing that covers as much as possible, limiting exposure to sun, avoid using tanning beds or sunbathing. Cancer related to diet. Bad eating habits are the cause of 1/3 of deaths in the United States. People that have a lack of healthy diet are most likely to develop cancer. Much research has been done that associates diet to cancer, and experts agree that our consumption of food can put us at risk. A number of food and drinks are known to increase or reduce the risk of cancer because of different chemicals or nutrients that they carry that can either prevent or put you at risk. The 2 cancers that are directly related to diet are colon and rectum. Colon cancer is cancer of the large intestine, the lower part of your digestive system. Rectal cancer is the last several inches of the colon. Together may be referred to as colorectal cancer. Colon and rectum cancer. Some cases of colon cancer may begin as small, non-cancerous clump of cells referred to as adenomatous polyps. Gradually they become colon cancers. Signs and symptoms directly depends on the location of the tumor. At first they may not have symptoms like stomach cancer, but some may show few symptoms in the beginning. Symptoms can include vague or cramps in one abdominal area, change in bowel habits, and blood may be visible in stool. When cancer gets worse for the collateral cancer, it is worsen and cause obstruction of the colon that will require surgery. Risk factors may include age, heredity, inheritance, inflammatory bowel disease, physical inactivity, obesity, heavy consumption of alcoholic beverages, or smoking cigarettes. Reducing your risk. Eating whole grain foods rather than processed grain foods, consuming 5 or more servings of fruits and vegetables, limit alcoholic beverages by 1 serving per 2 days, limiting the consumption of red meats and processed meats, meats cooked at an adequate temperature that may be high while grilling. Aspirin is also known for having a protective effect against collateral cancer when taken daily. Exercising daily or at least a few times a week to reduce your risks. Conclusion. We decided that in order to have early detection, it is imperative to do research and know your body. Knowing your body can help know when something is just not right. This will help in early detection because if you realize small warning signs that something is wrong, then you will have a better chance at early detection. Also, research will help early detection because you will know how the body is supposed to work, so you will know when something is not right. The treatment goes along with the detection. Once we get the disease detected early, then the doctor will be able to decide the best method of treatment. We decided that we can help cancer patients in all aspects of the process. Physically, we can help them by making sure that they are getting the correct care. This is important to making sure that physically they are doing well. Psychologically, we can help them by being there for them whenever they need us. Many people just need someone to talk to, and we would be that person. Socially, we can help them by making sure that they are surrounded by loved ones. Often, being alone can be discouraging to someone dealing with cancer, so it is important to try and keep their life as normal as possible. Our main objective would be to make the person feel like they had people there for them because we feel that is the best thing for a cancer patient. Resources.